United Nations Fund for Population Activities, UNFPA, delivers a world where every pregnancy is wanted, every birth is safe, and every young person's potential is fulfilled. Improving maternal health, MDG 5, is a key UNFPA priority.
The tragedy of maternal mortality is universal. It's neither public or private. UNFPA is the UN body that is charged with the responsibility of taking international leadership on maternal health and maternal survival.
Without close collaboration between government, private sector, and international organizations and donors, I think the achievement of MDGs in general is barely impossible. We need to collaborate. That comes naturally, I think.
According to a United Nations Fund for Population report of 2011, some 215 million women worldwide who would like to avoid or delay a pregnancy lack access to effective contraception. Fulfilling this unmet need for modern family planning in the developing world would reduce unintended pregnancies to 22 million from 75 million.
If you make sure that women have access to family planning so they can space their births, right? You actually reduce maternal mortality. Family planning is one of the keys in terms of reducing maternal mortality. It also reduces HIV infections in childhood.
Another key area that affects efforts to improve maternal health care is lack of proper infrastructure, especially in the rural areas, the report says.
It's an issue of access. Right? How do we, even if we put up an infrastructure in northern Kenya, right? How does a woman who is pregnant get from one place to the facility, which may be 10 kilometers, but the roads there are impassable, right? So it is that physical access which is an issue.
It is therefore important to note that maternal health care is very essential to the general economic productivity of the country.
Absolutely. The biggest measure of the health of a nation or the health of a community is how it treats its women and how it treats or gives maternal health care. When maternal health care is poor, the health of the people generally, not just children, not just women, but men too, is generally poor. And when the health of the people and communities are poor, productivity is low. There's therefore an inherent interest in the private sector that is so concerned about productivity to help the government and help countries ensure that everybody, men, women, and children, are in good health.
So we pay a lot of emphasis on a woman's health for her own sake, so that she doesn't die during delivery, and for the child's sake, so that she does not deliver low birth weight baby. So a healthy woman is crucial. She must be healthy before she gets pregnant, while she's pregnant, and during delivery.
Working with a range of partners, UNFPA will assist the Kenyan government in delivering sexual and reproductive health care throughout the life cycle of women and youths. These areas include voluntary family planning and antenatal safe delivery and postnatal care, among others. Josephine Wawera, GBS.